Ladies and gentlemen, the President of the United States, Donald J. Trump.
Well, thank you very much. It's great to be here on this very beautiful day. A lot of very positive things happening. Less than 4 months ago, I stood before you to announce the launch of the TrumpRx.gov, a brand new website featuring the largest discounts on prescription drugs in the history of our country, the history, frankly, of any country. And for decades, Americans paid the highest drug prices anywhere in the world by far. But under the most favored nation agreements I negotiated, we now pay the lowest price paid for anybody in any country. We went from the highest to the lowest, and I think outside of maybe a cure itself, it's the biggest thing to happen to healthcare and everything having to do with medical in any way, shape, or form. There's never been anything like this. We think of it, we went from the most expensive to the least expensive. So we've slashed the price of dozens of commonly used prescription drugs by differences of 400, 500, and even 600%. In my first term, I got it down 1/8 of 1%. It's the first time in 28 years it went down 1/8 of 1, and now we're talking about 4, 5, and 6, and even 700%, including for weight loss drugs, fertility treatments, insulin, and much, much more. Since that launch in February, TrumpRx.gov has already been visited more than 10 million times and has saved American consumers over $400 million already, and it's really the hottest thing in medicine. It's been amazing. I asked Dr. Oz, how's it doing? Bobby was there. He said, nobody's ever seen anything like this, so it's great. People are saving a lot of money. Over the next 10 years, the Council of Economic Advisors estimates that our most favored nation drug policies will save Americans over $500 billion. And this has been the greatest breakthrough in lowering healthcare costs in modern history. But we're just sort of getting started, actually, because we have a lot more to come. So today I'm thrilled to announce that we're increasing the number of drugs available on TrumpRx by nearly 7 times, adding over 600 affordable generics to the website, working with industry partners. Cost-effective generic drugs are often available at just a tiny fraction of the price of their brand name equivalents, and in theory, they're the same thing. Sometimes they're better, with the same dosage, the same effectiveness, and the same active ingredients, yet many consumers do not think to ask for them. They don't know about them. By incorporating this massive catalog of low-cost generics at TrumpRx.gov, consumers will now have one source to ensure that they're getting the lowest possible cost on their prescription. So they have a real option now. Today, they have something that they've never had before. They've never had anything like this or even close. With these additions, TrumpRx will feature the best and lowest prices on prescriptions used by tens of millions of Americans already. And in some cases, the discounted generics available through TrumpRx may be offered at an even lower cash price than the out-of-pocket insurance cost, which has always been the lowest, but we're going to be lower. This means that the TrumpRx.gov should always be your first stop before you go to the pharmacy to pick up your prescription, and you'll certainly be checking on your pharmacy by doing this, and at a minimum, you'll know what you're supposed to be paying. I want to thank the leaders of several major pharmacies and generic drug makers who are partnering with us on this effort, including the co-founder of Cost Plus Drugs, Mark Cuban. Mark, thank you very much. Mark, looking good, Mark. Come here, Mark. Nice to be here. Thank you, sir. Appreciate it. We have the same thing, one thing in common. We want to make people better and keep them wealthy, right? Good. Good to be with you. Vice President of Amazon Pharmacy, Tanvi Patel. Thank you very much. And the president of RX Marketplace at GoodRx, Aaron Crittenden. Aaron, thank you very much. Great job you're doing. With these companies as partners, we're also getting and adding new tools to take over websites which will connect patients with the lowest price pharmacy right in their own neighborhood, or alternatively give them the option of getting a discounted prescription shipped straight to their door. They can have it delivered right to their front door. This will provide American consumers with new options, more savings, and unprecedented price transparency, putting billions and billions of dollars back into the pockets of hardworking Americans. What a difference it's going to make at the end of a week. For generations, drug prices have only gone up, and under my administration, for the first time in history, drug prices are coming down, and they are coming down very, very dramatically and substantially. Politicians from both parties promised for decades to make health care more affordable, but they all failed, every single one of them. And when they thought they had it, they couldn't get other countries to go along. I got all the other countries to come along. I said, you don't come along, we're going to tariff you. And they all said, we'd love to come along, sir. But I'm actually getting it done, and I don't care how I do it. I got to get it done for the people. I want to thank the incredible team behind this historic accomplishment, including Secretary of Health and Human Services, Robert F. Kennedy Jr., Bobby, Administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. What a team this is. And Chief Counselor of Health and Human Services, Chris Klump. And I also especially have to thank the genius behind the world-class website that will soon be serving hundreds of millions of Americans, Airbnb co-founder and Chief Design Officer of the United States, Joe Gebbia, who's really amazing, and Ed Korstein, and the team at the National Design Studio, which is as good as you get. Under my America by Design executive order, Joe and his design team have been working to make your government more beautiful, more modern, convenient, and effective. In addition to the TrumpRx website, they've built the amazing experience behind TrumpAccounts.gov and the new food pyramid, Freedom 250, and much more. They're doing a job for the country like I can say design-wise nobody has ever seen. So, Joe, please show us how TrumpRx is bringing the modern face to healthcare and really helping us to save lots of money and lots of lives. Joe, please, thank you.
Thank you, Mr. President.
Thank you very much.
Thank you, thank you. In just months, TrumpRx has accomplished what Washington said couldn't be done. Those numbers you shared represent huge savings at real scale for real Americans. And none of this would be possible without your leadership and your belief that Americans deserve better health. So, today's great announcements of more drugs, more pharmacies, and home delivery are making healthcare simpler and smarter for Americans. Let's go live to the new TrumpRx experience. So that $400 million saved for Americans, that means better living and less stress for millions of families. So let's browse some of those medications. Immediately, you'll see a new section called Presidential Deals. These are some of the most affordable brand name drugs in America, made possible thanks to our president's legendary deal-making. So let's take a look at a few of these. This is Foundayo, the new GLP-1 pill, 77% off. This is the insulin medication, 72% off. This is Trulicity, 61% off. These are life-changing savings for millions of Americans. Now, search also got smarter too. You can now look up brand name drugs and see the generic version. Let's try a brand drug named Glucophage. It's for diabetes and it costs around $20. So search now shows the lower cost option, Metformin. Metformin has the same active ingredients, but now watch this. The price, $8.42. So you found an affordable price. Now where do you get it? You can find your trusted pharmacy in one search. Watch how easy this is. I'll use mine. Capsule Pharmacy. Boom, there it is. Now, we also created another way to find the best price, introducing Map Search. For the first time, you can see chain and local independent pharmacies on the same map. So here's my location. I see an option here at a pharmacy for $18, and a block away, $8.42. Now you can compare for the best medicine prices, as easy as it is to compare hotels or Airbnbs or baseball tickets. This is simple, transparent healthcare pricing. So when I find what I'm looking for, I take this coupon, show it to the pharmacist, and I get the TrumpRx price. That simplicity is why TrumpRx has taken off nationwide. Okay, there's one more thing. Today, we added new partners for fast home prescription delivery. I can actually get this medicine to my door in a day or so. So from search to savings to satisfaction, this is healthcare built for modern life. You compare prices on flights. Why not medicine? Don't just fill your prescription. Trump or exit. Because the strongest nation on earth, America, starts with the healthiest people on earth. Mr. President, back to you.
Thank you, Joe. Great job. Beautiful. Thank you. Well, thank you very much. Really amazing the job you've done. And so quickly now, I'd like to ask Secretary Kennedy to say a few words, and Dr. Oz and Mark Cuban and Chris Klump. And we'll take a couple of questions maybe at the end. Thank you. Bobby, please.
Thank you, Mr. President. The epidemic of chronic disease in this country is now existential. If you include my agency plus Social Security and the VA, Americans now spend 48 cents out of every dollar that we spend in federal taxes now go to health care. 90% of that is for chronic disease. And those costs are increasing at 2% at greater speed than the GDP. In addition to that, it poses an existential threat to our national security. 77% of American kids cannot qualify for military service. President Trump has pledged to end the chronic disease epidemic, but in the meantime, many people need medications to treat their chronic disease. And President Trump has asked us to make our country, the most affordable medication in the world, and he succeeded in doing that. And I want to say one last thing. President Bush promised to do this. President Clinton promised to do it. President Biden promised to do it. President Obama promised to do it. President Trump actually got it done. And it's an extraordinary accomplishment. It's an extraordinary legacy for him, and it's a gift to the American people. And I want to thank you again for your vision and for your determination.
This is yet another example of this administration and the president's leadership making life more affordable. And it's in a particularly important arena because almost 1 in 3 Americans, when they go to a drugstore, cannot afford to pick up the medications that their doctor prescribed for them. And part of the reason for that, which the president recognized early on and pushed hard until it got done, because it was a force of his personality that allowed us to go to all the major pharmaceutical companies representing the vast majority of the marketplace of branded drugs in America. But what he realized was we're paying 3 times more for the exact same drugs made in the same facilities, often in this country, than people overseas are paying for those exact same drugs. Whether it's weight loss drugs, fertility drugs, you name it, we're overpaying for it. President wanted that stopped. He wanted it stopped now. And so he did it. The most favored nation drug pricing approach works using a variety of techniques that he outlined, but we needed to make sure you had an ability to access these drugs. TrumpRx.gov is a phenomenon. Over 10 million people have visited the site. It is the fastest site of its kind I've ever seen. As a physician who's used to looking at medications and having no idea what the patient will pay, it's as transparent as you just saw, built by the fantastic team with Joe Gebbia. They started with dozens of medications, Mr. President, which is the number of medications that had been negotiated by Chris Klump and the team at HHS. Today, 601 more medications were added. 601 more. As the president said, 7 times more drugs are now in this list, which means something really important. You should not buy a drug in America without first checking the best transparency site ever created for medications to make sure you're not being taken advantage of. You wouldn't go grocery shopping without knowing prices. You wouldn't buy a car without knowing prices, lease an apartment or anything else. You shouldn't do it with the medications that could save your life. We believe that more than half of all the prescription interactions in America are now going to be revealed on Trump RX. If you wish to use the site in any capacity, this is the time to start. It's a technological feat. It's created transparency with no middlemen. Just what the president promised. And for that reason, we ask you today to go look at the site, TrumpRx.gov. Ask us to put you on our mailing list. So when the team at the National Design Studio wants to contact you about new medications that are being offered, new ways for you to save money, new ways for you to make health more affordable, so your zip code doesn't determine your health, you'll have TrumpRx.gov to go to. Mark Cuban has been an outspoken advocate for more transparency in medications. He built a business around it, and he's one of the companies that's joining us now to put their products on TrumpRx.gov. Mark?
Thank you for having me, Mr. President. I think other than you, I've been the biggest proponent of TrumpRx.com. And the reason for that is Republicans want cheaper drugs, independents want cheaper drugs, Democrats want cheaper drugs, and together, I think we're going to do something special. What makes Cost Plus Drugs different is that when you click through TrumpRx to our site, not only will you see a great price, but you'll see our actual cost and that we only mark it up 15%. And what makes this incredible, Mr. President, all the volume and all the people that are going to come from the site, as our volumes go up, our costs go down, which means we'll be ending up charging less to people over a period of time. So this is a special announcement. This is a special partnership. 559 of those drugs are ours, so we're really excited to be part of this. Thank you so much for having me. And I'll turn it over to Chris Klopp. Thank you.
So you've just heard about the addition of generic medications on TrumpRx, which is fantastic. TrumpRx is now the true single source of truth for the lowest prices for American families on their prescription medications. But what matters even more is what comes next. So we are on an irreversible trajectory. An American family right now taking a GLP-1 will save this year, right now, about $1,800 less than they would have 4 months ago before the advent of TrumpRx.gov. An American family trying to conceive and needing fertility medications will save nearly $6,000 per live birth right now, thanks to TrumpRx.gov. That's nearly $5 billion going to the pockets of hopeful parents over the next decade. So how do we achieve this? By proving that in America, you can do well by doing good. TrumpRx has created a revolutionary vehicle for a true public-private partnership. Private innovators are stepping up to the plate, and they're doing it not just because it's the right business decision, but it's the right moral decision. So to accelerate this process, we will continue focusing on 3 things, the same 3 things we talked about you in our last conversation on most favored nation pricing led by the president. First, we continue to bring additional industry partners on board. Last time we had a conversation with you about MFN, we put out a call to small and mid-sized biotechnology manufacturers and pharmaceutical companies to come sit with us to make their product portfolios available at MFN prices. We said that we would be fair and we would be reasonable, and the industry has answered that call. We've been inundated with demand for discussions to ensure that every American family can continue to access MFN prices, not just for the companies that have been negotiated, but for the many that are yet to come. Number 2, as the president mentioned, we are continuing to negotiate international trade agreements. Those are well underway, working lockstep with our partners at Trade and at Commerce. And number 3, legislation. We are continuing discussions on the Hill with Congress to ensure that the president's great health care plan lasts for decades to come, guaranteeing greater affordability, greater accountability, greater transparency for every American family. It turns out, as Mark said, there is appetite on both sides of the aisle to make progress on this important point. When a parent goes to the pharmacy, they're not thinking about political ideology. They're thinking about what's best for their family. And today, leaders across the spectrum, irrespective of their party, are standing together because Americans demand affordable health care, and it's an American imperative. This president has set us on a course to permanently benefit from lower drug prices as a country. The foundation is built, the market is engaged, the future is affordable, and I yield the podium back to the man who made all this possible. Thank you, Mr. President.
Would you like to say something? You're over there. You look so beautiful and nice. You two, come on over here. Just say a couple of words about.
Thank you. Thank you, Mr. President, for having Amazon here today. It's really great to work with the administration and the NDS on building TrumpRx at Amazon Pharmacy. It's been our mission to build a pharmacy with price transparency from day one. And it's been our mission to make sure that Americans who need their medications know how much they're going to pay out of pocket for brand or generic medications. It's what we're built around, whether you're paying cash or insurance. And we look forward to continuing to innovate on this.
Thank you very much. Thank you. Good luck with it.
Move this up just slightly. Thank you for having us on behalf of GoodRx. Look, we have shared mission as everyone up here to deliver health care that's affordable to every American. We couldn't be prouder by what you're doing and be part of it. So thank you so much.
Well, thank you very much. Any questions of these brilliant people? Yeah, please go ahead. Go ahead. Yes. The white. Yes.
Mr. President, on the IRS,
They're giving a briefing on it a little while at the mosque. They're giving a briefing, and
President
it's a
Trump.
terrible situation. I've been given some early updates, but we're going to be going back and looking at it very strongly. Yeah, please.
President, Justice Fund
speak a
created
little bit about
$1.7 billion
Can you speak a
that
little
the
bit about
IRS
your
is now
pause
going
on
to.
Wait, excuse me?
Can you speak a little bit about your pause on Truth Social on Iran, and what was the decision that why you didn't attack Iran?
Well, other countries have come to me and they've said we were getting ready to do a very major attack tomorrow. I've put it off for a little while, hopefully maybe forever, but possibly for a little while, because we've had very big discussions with Iran, and we'll see what they amount to. I was asked by Saudi Arabia, Qatar, UAE, and some others if we could put it off for 2 or 3 days, a short period of time, because they think that they are getting very close to making a deal. And if we can do that, where there's no nuclear weapon going into the hands of Iran, I think, and if they're satisfied, we will be probably satisfied also. We've informed Israel. We've informed other people in the Middle East that have been involved with us. And, it's a very positive development, but we'll see whether or not it amounts to anything. We've had periods of time where we thought pretty much getting close to making a deal, and it didn't work out, but this is a little bit different. Now, we're ready going tomorrow, very big, and not something I wanted to do, but we have no choice because we cannot let Iran have a nuclear weapon. Yeah.
The Justice Department has this new fund that was announced today, $1.7 billion.
Yeah.
Why should taxpayers pay for the January 6ers?
Well, it's been very well received, I have to tell you. I know very little about it. I wasn't involved in the whole creation of it and the negotiation. But this is reimbursing people that were horribly treated, horribly treated. It's anti-weaponization. They've been weaponized. They've been, in some cases, imprisoned wrongly. They paid legal fees that they didn't have. They've gone bankrupt. Their lives have been destroyed. And they turn out to be right. I mean, it was a terrible period of time in the history of our country. And they worked on it. I know the Justice Department, it's really been working on it very hard. There's been numerous other occasions over the years where things like this have been done. But these were people that were weaponized and really treated brutally by a system that was so corrupt, with corrupt people running it, and they're getting reimbursed for their legal fees and the other things that they had to suffer. Yeah, please. Daniel, go ahead. Hold it, Daniel, please.
Thank you, Mr. President. It's pretty remarkable seeing you and Mark Cuban up there, and the fact that obviously Mark endorsed Kamala Harris back in 2021.
Well, he made a mistake. It was a big mistake.
What does this say about what you two are building here?
Well, it says we love people. We love our country. He's got a good company, and he's going to do a lot of business with this. And I'm going to get drugs out through Amazon, through the whole group, and we're going to get drugs out. And Mark wanted to be a part of it. And I think Mark was very gracious. He said, this is something that really works. The first time you've seen it. And he had to believe that if he said it about me. You have to understand that. But look, I think I have a lot of respect for Mark, frankly, and I always have.
And then, sir,
Go ahead, Ebola. Ebola, you said Ebola.
Yeah. Should Americans be concerned about Ebola?
Yeah, I'm concerned about everything, but certainly am. I think that, it's been confined right now to Africa, and but it's something that has had a breakout. I could ask Bobby or Oz to say a couple of words about it, if you'd like. Do you want to do that?
I think Heidi Overton is going to come up and give us a few words here. Dr. Overton.
Thank you, Mr. President. Today, the CDC held a press briefing that provided a lot of the answers and information, but we have stood up a full interagency response. The Department of State, the CDC, the Department of War, everyone is fully involved in tracking. Today, we do have an announced today at the press briefing. There is an American that is symptomatic and has tested positive for, it's the Bundibuja virus, a strain of Ebola. That American, as well as 6 other high-risk contacts, are going to be taken out of that region and taken to Germany. We want to thank our German counterparts. That is an internationally recognized location for viral hemorrhagic fever treatments. So we're very grateful that they would take them. It's a significantly shorter flight time for Americans to receive treatment there in Germany. For all other Americans, we have issued travel warnings. We have We have instituted just today entry restrictions for non-U.S. citizens that have been in the region in the past 21 days. So in Uganda, Democratic Republic of Congo, and South Sudan. So very serious measures that have been taken. We are working to communicate very frequently with everyone. Your question was, should Americans be worried? Right now, there are no cases of Ebola in America. We want to keep it that way, and we are doing everything we can to support Americans in the region. Thank you, Mr. President.
President Trump, over here. President Trump.
Go ahead, on Iran.
Yes, follow up on Iran. Other countries have done this before. They have asked you to change course in order to they dangled a peace deal in front of you saying one was coming. Nothing has come into fruition. You mentioned this.
Well, a lot's come into fruition. We've taken a country that was going to have a nuclear weapon, and we've virtually destroyed its military. They have no navy. They have no air force. They've been virtually destroyed militarily. That's a lot. That's a big. We could leave right now. It would take them 25 years to rebuild. And the last thing they're thinking about, I think, is nuclear. Now they have to put it down in writing. But when you say nothing, we've totally destroyed. Excuse me, from CNN. We've totally destroyed their military. We've destroyed their leadership. As you know, their leaders are gone. Their leaders are gone at the first level. The second level, we're dealing with half of the third level. And I think we've made a lot of progress. And it's very simple. You know, we don't want to go through this. We had the greatest economy ever. We still do. The stock market hit a brand new high a little while ago. I never thought that was going to happen. We had to make the excursion. You know, we hit 50,000 on the Dow. We hit 7,000 on the S&P, and everyone said that couldn't be done within my 4 years. It would be too big. Well, we did it in my first year. And then I called Scott and Howard. I called them all into my office. I said, we're going to take a little excursion down to the Middle East, and we're going to confront Iran because they are desperate to have a nuclear weapon. And the only reason they want it is to use it. And I said, I hate to do this because we're doing so well, but this is the most important thing we can do. We can't let Iran have a nuclear weapon. So we did that. And when we did that, we were met with a little force, and we ended up destroying them. We now have a tremendous, we built really a steel wall where no boats are blockade, where no boats are able to, not one boat has been able to get through our blockade. Look, our military is the greatest military anywhere in the world. I just left China, and I will say President Xi was very, very complimentary of our military. He was amazed, actually, at our military. We have the greatest military in the world. We're not going to let Iran have a nuclear weapon. So I was called by these three countries, plus others, and they're dealing directly with our people and, right now, Iran. And there seems to be a very good chance that they can work something out. If we can do that without bombing the hell out of them, I'd be very happy. Please.
I have a question on weaponization. Do you believe that people who committed violence against Capitol Hill police officers on January 6th should be eligible for compensation from this DOJ fund? And are you or your family members going to be seeking compensation from that fund?
It'll all be dependent on a committee. A committee's being set up of very talented people, very highly respected people. I think it's a committee of 5. And again, I didn't do this deal. It was told to me yesterday. They said they're doing something. I do believe there has to be compensation for people that were destroyed. You have families absolutely destroyed, and it's all going to be determined by a committee of 4 or 5 people that are respected and very brilliant at what they do. Yeah, please. Go ahead, please. No, one at a time, please. In the blue, yeah.
Thank you, Mr.
In the blue, yes. Go ahead, please.
Thank you, Mr. President. On election integrity, so a lot of Republicans, including you, are speaking out against a massive mail-in ballot era in Maryland.
Yeah, terrible.
How concerned are you about election integrity as Americans are heading into the midterms?
I'm very concerned about it. I'm very concerned about mail-in ballots. We're the only country in the world that's doing mail-in ballots, and a mail-in ballot is, by just the nature of it, it's going to be corrupt. So many people handle it. You go into a well-run voting booth in a certain state, you know, we'll pick a state, but you go into, and I mean, they look, even me, I went in Florida and went to vote, and they said, sir, I hate to do it. I'm so embarrassed. Could I see your identification? I said, really? Do you really want to do that? Please, sir. I'll lose my job if I don't do it. I was very proud to hand her identification and everything else. I mean, you want to have proof of citizenship. You want to have a voter ID. You want to have all these things. But to me, maybe the worst of all is the mail-in ballots where They come in. So, as you know, in Maryland, 500,000 fake ballots were sent out. When they were caught, they said, "Oh, we'll pull them back," and they issued 500,000 new ballots. And as you know, they never got the original ballots back. So there are 1 million ballots out there. Many of them went to Democrats, and it's a very serious thing. And I'll tell you, I've looked at Maryland for a long time, and I know Maryland pretty well. And I was told that it's automatically a Democrat state, and I don't believe that because I think I did really well there, and I don't believe it. But they issued, as you just got caught recently, 500,000 ballots, illegal ballots were sent out, and they were totally fraudulent. And then they said, "Oh, we'll pull them back." Well, they didn't pull them back, and they have 500,000 new ballots go. So what happens to the original? Are they going to come in, and are they going to come in and infect our system? So it's a very, very serious thing that's happened, and I've asked the law enforcement to look at it very, very strenuously. I want to thank you all. We're so proud of it, and I want to thank Bobby and Oz and Mark and all of the people that are here. And Joe, great job. You are really something. I heard about you for a long time, and now you're doing something that's more important than anything you've ever done, and you've done some beauties. Thank you very much, Joe. Thank you very much, everybody. Appreciate it. Thank you. Thank you.